Picture old-timey medicine, and you probably imagine some ignorant village healer doing his best with herbs and superstition, someone you can forgive because he simply didn't know better. That's the comfortable version of history. Here's the uncomfortable one. Every treatment on this list was performed by elite, fully credentialed physicians, the most respected doctors money could buy, and they did it with complete confidence. And before you file this under ancient history, the last lobotomy performed in the United States happened in 1967. The patient was 12 years old. We'll get to that one. We're ranking 10 real medical treatments from the ones that barely qualify as torture up to the one with a higher death rate than the disease it was meant to cure. And here's the part that should bother you more than anything else on this list. The doctor behind the very worst entry wasn't arrested, sued, or stripped of his license. He won the Nobel Prize. Let's start at number 10. Number 10, bloodletting. For about 2,500 years, the most common medical advice on Earth was simple. You have too much blood, let's fix that. Doctors believed the body ran on 4 fluids called humors: blood, phlegm, black bile, and yellow bile, and that almost any illness, from a headache to a broken leg, was just one of them getting a little too confident. The fix never changed. Open a vein, drain a few pints, and hope the disease left with it. Leeches did the job sometimes, left attached to the skin until they were satisfied, which could take minutes or hours depending on how hungry they happened to be. A blade did it other times. Doctors carried portable bleeding kits the way a modern doctor carries a stethoscope, ready to use on basically any complaint that walked through the door. This wasn't folk medicine. This was the gold standard, which is exactly why George Washington spent his final hours in 1799 getting drained of roughly half his blood by physicians who, at the time, believed they were saving him. He died a few hours later. Nobody at the bedside took that as a clue, and the same treatment stayed standard practice for another 50 years, on children, on pregnant women, on anyone who simply looked a little pale that morning. 2.5 millennia of confidence, and it turns out confidence was never the same thing as being right. If you think draining blood out of one end of the body was bad, wait until you hear what doctors were doing to the other end. Number 9, the tobacco smoke enema. In the 1700s, doctors came up with a genuinely creative way to revive drowning victims. Blow tobacco smoke directly into their rectum using a bellows, the same kind you'd use to start a fire. The theory was that the warmth and stimulation would shock the body back into action. Basically, a defibrillator. Except the defibrillator is smoke, and the paddles are a tube you really don't want to think about. Resuscitation kits built specifically for this were kept along riverbanks in London for public use, meaning at any given moment there was a stranger nearby fully prepared to do this to you if you so much as looked like you'd fallen in a lake. No license required, just confidence and a bellows. It was considered legitimate enough to make it into actual hospitals too, complete with an instructional pamphlet on correct technique, which somehow makes it worse, not better. So if you've ever wondered where the phrase blowing smoke up your ass actually came from, congratulations. It's not a metaphor. That one at least had a logic to it, however broken. The next one didn't even need that. It just needed a sharp tool and someone willing to use it. Number 8, trepanation. This is the practice of drilling a hole directly into a living person's skull, and it is not new. Archaeologists have found trepan skulls over 7,000 years old where the bone clearly healed afterward, meaning the patient didn't just survive the procedure. They walked around for years with a permanent hole in their head. The reasoning shifted over the centuries, from releasing trapped evil spirits to relieving pressure after an injury, to treating headaches, seizures, and what doctors vaguely called melancholy, a diagnosis broad enough to mean anything from grief to a bad week. The method stayed the same the entire time. A sharp tool, a steady hand, and a patient who was usually fully awake since nobody had invented anesthesia yet. The only mercy is that the skull itself has no pain receptors. Everything leading up to that point, the scalp, the muscle, the sound of it grinding through bone, absolutely does. Some skulls show evidence of multiple separate trepanations on the same person over the course of their life. Whatever was wrong with them either kept coming back, or the cure itself had simply become the routine. Drilling into a skull was at least over quickly. The next cure on this list took years to finish the job. Number 7, mercury for syphilis. For nearly 500 years, the standard cure for syphilis was mercury, rubbed into the skin, injected, swallowed as pills, or inhaled in small wooden steam boxes filled with vapor until the patient sweated, which doctors took as proof the treatment was working. There was even a saying at the time, a night with Venus, a lifetime with Mercury. Either the bleakest pickup line in recorded history or the most honest STD warning ever written. The treatment caused excessive drooling, teeth that loosened and fell out, kidney failure, uncontrollable tremors, and in advanced cases, total mental collapse. Patients weren't just suffering from syphilis anymore. They were being slowly poisoned by their own prescription on a daily schedule, by a doctor actively billing them the entire time. Some patients stayed on mercury for so long that doctors eventually treated mercury poisoning as its own separate diagnosis, completely unrelated on paper to the disease that started it. Mercury worked slowly. The next method on this list worked almost instantly, and that turned out to be the problem. Number 6. Cauterization. Before doctors had any reliable way to stop heavy bleeding, the solution was simple. Apply something extremely hot directly to the wound until it stopped. Sometimes that meant a glowing iron rod pressed onto torn flesh, used so often in field hospitals that surgeons kept a fire burning nearby just to have irons ready. Sometimes, especially after gunshot wounds, it meant pouring boiling oil straight into the injury, considered standard practice across multiple armies for centuries, all arriving at the same idea independently. The logic, to be fair, technically works. Heat does stop bleeding by sealing the vessels shut. It just does it by handing you a second, much larger injury to deal with while the first one heals underneath. A bit like putting out a small kitchen fire by setting the rest of the house on fire too, and calling that a successful intervention. Patients were sometimes given alcohol beforehand, not really as a painkiller, but because a half-conscious patient was easier to hold still than a fully alert one screaming directions at the surgeon. Stopping bleeding with fire was at least over in seconds. What came next could take minutes. And those minutes were the entire point. Number 5. Amputation without anesthesia. Before ether entered surgery in 1846, the entire profession ran on a different metric. Surgery wasn't measured in skill. It was measured in speed. Surgeons were celebrated the way you'd celebrate a fast food drive-through window. The quicker they worked, the less time you spent conscious and screaming, and the less blood you lost while they figured it out. Patients were held down by 2 or 3 assistants, handed a shot of whiskey if the hospital was feeling generous, and given a leather strap or a piece of wood to bite down on. A genuinely skilled surgeon could remove an entire leg in under 2 minutes flat, which sounds impressive, until you realize the cutting was the easy part. Roughly half of all surgical patients in this era died days or weeks later anyway, not from the operation itself, but from the infections that followed, because nobody had yet figured out that washing your hands or your instruments between patients might matter. Surgeons would move from one operation straight into the next, wearing the same blood-soaked coat, treating the stains as proof of experience, rather than a warning sign. The surgery itself usually wasn't the dangerous part. Surviving afterward was. By comparison, the next entry on this list didn't even look like medicine going wrong. It looked like medicine working perfectly, right up until it didn't. Number 4. Radium Medicine. In the early 1900s, radium was marketed as the next great miracle cure. Bottled into tonic water, baked into chocolate bars, blended into face creams, even sold as suppositories, all promising more energy, relief from arthritis, and a fix for male impotence. People drank it daily, believing the faint glow and warm tingling sensation were obvious signs of restored health. It was the exact opposite. Radium accumulates permanently in human bone, quietly destroying it from the inside over months and years, replacing healthy tissue with nothing at all. One of the most famous victims, a wealthy industrialist named Eben Byers, drank so much radium-laced tonic water on doctors' orders that his jaw eventually crumbled away and his skull developed holes you could see through. He died of radiation poisoning and was buried in a lead-lined coffin, the kind of detail you usually only hear about with nuclear waste. Not a guy who just wanted more energy in the mornings. The product he drank, Red Ethor, was sold under the slogan Perpetual Sunshine, which in hindsight reads less like a tagline and more like a confession. The slogan promised energy. What it actually delivered, slowly and invisibly, was a body falling apart from the inside, bone by bone. Radium took years to show its damage. The next 2 entries went straight for the brain, and they worked almost immediately. Number 3, Metrazol shock therapy. In the 1930s, psychiatrists became convinced that deliberately triggering a massive, full-body seizure could shock mental illness directly out of a patient's brain, the same way you might restart a frozen computer by unplugging it. The drug used, Metrazol, worked almost instantly after injection, giving patients only a few seconds of full awareness before the seizure hit, just long enough to feel pure dread, nowhere near long enough to brace for what came next. The convulsions were violent enough that patients regularly fractured their own spines or shattered their own teeth from clenching their jaw mid-seizure. Staff eventually started physically strapping patients down before every injection, purely to stop them from breaking their own bones, which tells you everything about how confident anyone actually was that this was working. Metrazol stayed in regular use at psychiatric institutions for over a decade before doctors widely agreed that a treatment patients actively begged to avoid probably wasn't helping anyone. When the staff has to restrain you before treatment even starts, that's not a side effect. That's the treatment telling you exactly what it is. If Metrazol was the brain getting violently shocked, the next method was slower. And somehow that wasn't any better. Number 2. Insulin shock therapy. Around the same era, doctors developed another method for treating schizophrenia, deliberately inducing a coma using massive, repeated insulin overdoses, then slowly reviving the patient with sugar through a tube. This wasn't a one-time procedure. Patients went through this cycle daily, sometimes for weeks straight, occasionally stretching into months, drifting in and out of medically induced comas while nurses sat beside each bed watching for improvement that, in most documented cases, simply never came. The treatment carried a very real risk of permanent brain damage, irreversible coma, and death, and it was eventually phased out for the same reason most of this list eventually was. Someone finally asked what the actual scientific evidence behind it was, and found there wasn't really any. Just decades of doctors agreeing with each other. Hospitals advertised it to families as cutting-edge psychiatric care and charged accordingly, while patients spent weeks of their lives cycling in and out of unconsciousness with no real way to consent to any individual session along the way. There was no consent form built for something that happens to you 50 separate times. There was just the routine and the bill. Compared to this, everything else on this list suddenly looks almost gentle. Number 1. The Transorbital Lobotomy. By the 1940s, American physician Walter Freeman had perfected a procedure that took under 10 minutes, often performed directly in his own office. No surgical team, no operating room, frequently no anesthesiologist required. The method: insert a thin, ice pick-like instrument through the corner of the patient's eye socket, tap it through the thin bone behind the eye with a small hand mallet, then swirl it around to deliberately sever connections inside the frontal lobe. Patients were often only sedated with electroshock therapy beforehand, not real anesthesia, meaning they were frequently semi-conscious for the entire thing. Aware enough to hear the mallet, not quite aware enough to do anything about it. Freeman personally performed roughly 3,500 of these procedures over his career, occasionally completing several in a single afternoon like he was working through a waiting room rather than performing brain surgery, and he reportedly enjoyed showing visiting doctors how fast he could do it. The results ranged from mild personality changes to total emotional numbness, to permanent brain damage, to death, depending entirely on how the mallet happened to land that day. Among his patients was Rosemary Kennedy, sister of a future U.S. president, operated on in 1941, who never recovered the ability to walk or speak normally again. The youngest known patient to undergo this exact procedure was 12 years old. And here's the detail that makes this entire list worth sitting through. The doctor who invented this category of brain surgery wasn't arrested for it, sued for it, or stripped of his license for it. He won the Nobel Prize. So the next time you're sitting in a waiting room, mildly annoyed that your appointment is running 10 minutes behind schedule, remember, somewhere in the not-too-distant past, that exact same 10 minutes was enough time for someone to perform actual brain surgery using a fireplace tool, hand you back to your family slightly different than when you arrived, and walk away from it with an award on his mantle. Every treatment on this list was worse than the disease it was meant to fix. And every single one of them was once considered the best medicine money could buy. Medicine got better. It just took an uncomfortable number of these to get there. Thanks for watching. Make sure to like and subscribe if you really enjoy it. This is your host, signing out for now.